Picture this. You're at home, maybe feeling that familiar throb in your temples. A little dizzy, perhaps. And then you glance at your blood pressure monitor, and the numbers flash up, making your heart, well, skip a beat. Does that sound familiar? If you're over 60, you are definitely not alone. Nearly half of American seniors are navigating high blood pressure pretty much daily. But what if I told you there are some incredibly effective natural methods? Things that can help lower your blood pressure in minutes, not hours, using, nothing but your own body, and some surprisingly simple techniques. Okay, let's unpack this a bit. We're diving into insights from Dr. Lisa today. She's an expert who's spent, over 20 years integrating time-tested Eastern medicine with cutting-edge modern medical research. And her work isn't just theory. It's validated by big names like Harvard Medical School, Johns Hopkins, and AARP. We're talking about techniques that have the potential to significantly lower your systolic pressure, sometimes almost immediately. So whether you're dealing with those sudden elevated readings, maybe you forgot your medication one day, or you just want some natural backup strategies in your toolkit, this deep dive offers practical, science-backed tools.
Right. And what's really crucial to understand here right from the start is the distinction. These methods are fantastic for managing elevated readings, when the numbers are higher than you'd like. They're tools for proactive self-management. They are not for medical emergencies. And I have to be absolutely crystal clear on this critical safety warning. If you are experiencing chest pain, severe headaches, or sudden vision changes, please call 911 immediately. Don't hesitate. These techniques, while powerful for managing those high readings, they absolutely do not replace emergency medical care. And it's always, always essential to talk to your doctor before making any changes to your treatment plan, especially if you have existing heart conditions or you're currently on medications. Always check first.
Absolutely. Safety first, always. But with that really crucial understanding in mind, are you ready to explore some ways to maybe take a bit more control of your blood pressure naturally? Okay, let's begin our deep dive into 3 powerful, science-backed strategies you can actually use starting today. So our first method might surprise you a little because it's something we do, every single moment, right? Breathing. Yet its power often goes completely unnoticed. Research from Harvard Medical School has actually shown that something as simple as changing how you breathe can lower blood pressure by up to 10 points, and in just 5 minutes. Now, for anyone feeling a bit skeptical, what's the science here? How can something so basic be so, powerful?
It's fascinating, isn't it? When you engage in something like the 4-7-8 breathing technique, you're actually doing something quite profound physiologically. This slowed, intentional breathing, it directly activates your vagus nerve.
Ah, the vagus nerve. I've heard it called the body's sort of relaxation switch.
Exactly. Think of it like that, a major switch running all the way from your brain down to your colon. When you stimulate it properly through this kind of breathing, it triggers what scientists call the rest and digest response, and that cascade effect. It causes your blood vessels to gently widen, your heart rate slows down, and consequently, your blood pressure naturally drops. Dr. Kimberly Parks from Massachusetts General Hospital put it really well. She said, anyone with stage 1 hypertension should note that breathing exercises are an effective way to lower blood pressure without medication.
Wow, it's a really powerful statement suggesting breathing could even be a primary tool for some. So for our listeners wanting to try this, what's the single most crucial element, the thing they need to get right for it to actually work? And how exactly do we do it step by step? Okay, let me walk you through exactly how to master this 4-7-8 breathing method. It's pretty straightforward once you get the hang of it. Step 1, get positioned safely. First things first, sit up straight in a comfortable chair. And this is really crucial. Never do this standing up initially. Some people can feel a little lightheaded at first if sitting's uncomfortable, maybe due to arthritis or mobility issues. Lying down's perfectly fine too. Comfort and safety first. Step 2, the inhale phase. Okay, now you're going to breathe in quietly through your nose for exactly 4 counts. Really focus on feeling your diaphragm, that big muscle below your ribs, pull downward. You want your belly to gently expand outwards, not just your chest puffing up. It's deeper, you see. Step 3, the hold phase. Now, here's where, a lot of the magic happens. Gently hold your breath for 7 counts. Don't tense up, just hold. During this pause, maximum oxygen is getting delivered into your bloodstream, and your nervous system is kind of prepping itself for that deep relaxation response. Step 4, the release phase. Finally, exhale slowly through slightly pursed lips, like you're gently blowing out birthday candles for a full 8 counts. You should make a soft whoosh sound as the air comes out. This extended exhale, this 8-count exhale, is absolutely crucial. It's really when your nervous system gets the signal to relax, and that's when your blood pressure starts to normalize and drop.
And the science behind this, it isn't just anecdotal, There was a recent analysis published in Frontiers in Physiology that looked at 20 different studies specifically on breathing exercises. And what they found consistently were significant reductions in both systolic and diastolic pressure. What's really remarkable, I think, is that some participants actually saw results immediately, like within the very same doctor's visit where they first tried the technique.
Wow, immediate results. That's incredible.
It really demonstrates the body's innate ability to respond quickly when given the right signals.
That's amazing. Now, thinking specifically about seniors, are there any particular considerations? Or maybe ways to adapt this technique to make it safer or easier to start? Yes, absolutely. For seniors, there are definitely a few special considerations to keep in mind. It's really important to start slowly. Maybe just 3 to 5 breath cycles initially, not the full 5 minutes right away. Dr. Nicheng Liang, who's AARYP's pulmonary expert, she specifically cautions that seniors with conditions like COPD or existing heart issues need to be especially careful. She notes that while an average person might handle 5 minutes a day, someone with COPD might only tolerate, say, 3 to 5 cycles at first. Build up gradually. And if you feel dizzy at any point, stop immediately. Just breathe normally for a bit. Then maybe try again later, perhaps with shorter counts like a 3-5-6 pattern instead of 4-7-8. Listen to your body. Some seniors even find benefits just by focusing on the exhale phase initially, just pursing their lips and breathing out really slowly and gently. And to help with the timing, which can be tricky at first, there are tons of free breathing apps or online videos. They can give you visual or audio cues to keep you on track. Oh, and here's a really good tip. Try to practice this twice a day, maybe once in the morning and once before bed, even when your blood pressure is perfectly normal. Think of it like training your nervous system, building that resilience over time. The real beauty here is just how accessible it is. No equipment needed, no medication, usually no side effects for most people. It's just you, your breath, and maybe 5 minutes that could genuinely change how you feel for hours. But as powerful as breath is, it's just one pathway we're exploring today. Let's move on to something perhaps a bit more ancient, but equally fascinating and scientifically proven. Okay, our next method dives into an ancient healing art, one that modern science has increasingly started to validate. Acupressure. Imagine your body has these little built-in reset buttons, specific points, that when you press them can actually signal your cardiovascular system to just relax. Traditional Chinese medicine, or TCM, has known about these points for literally thousands of years. And now Western research has actually proven they work. We're talking about specific acupressure points that some studies show can lower blood pressure in as little as 30 minutes.
Indeed. There is a breakthrough study published by the National Institutes of Health, the NIH. It found that pressing specific points like LR3, which stands for liver meridian point 3, HT7, that's heart meridian 7, and KI3, kidney meridian 3, actually created measurable drops in blood pressure. And these effects lasted for hours in some cases. And the great thing, especially for seniors, is that this isn't about needles like acupuncture. No special training needed, no expensive treatments. It's literally just using your fingertips and knowing where to press. It seems almost too simple, doesn't it?
It really does.
So what's the underlying mechanism? How does simple pressure yield such, significant results?
That's exactly what I was wondering too. Okay, so let's pinpoint these 3 crucial spots on the body and learn exactly how to activate them. All right, point #1. This is LR3, or Taichong. Think of it as the liver's pressure relief valve. You'll find this one on the top of your foot. Feel for the spot between your big toe and your second toe. Now move back about 1 thumb width from where the toes meet into that soft depression there. That's LR3. In traditional Chinese medicine, this point is key for what they call rising liver yang, which often correlates with high blood pressure. Now, to activate it, use your thumb or maybe your index finger. Apply steady, moderate pressure, enough so you feel it, definitely, but it shouldn't be painful, just a firm pressure. Press and hold for about 5 seconds, then release for 1 second. Keep repeating that pattern for about 3 minutes on each foot. You should feel a kind of slight ache or maybe a tingling sensation that tells you you're on the right spot. And get this, clinical research actually shows this single point can reduce both systolic and diastolic pressure, sometimes for at least 30 minutes. There's even an example of a 68-year-old woman whose reading dropped from 156 over 94 down to 142 over 86 within half an hour just from using this point. Pretty impressive, right?
Very impressive.
Okay, point #2. This is GB20, or Feng, often called the wind pool. These are actually 2 points, one on each side, right at the base of your skull. Feel for the back of your head, down where your neck muscles attach to the skull. You'll find 2 natural hollows there, just below the big bone, the occipital bone, about 2 thumb widths apart. Those are your GB20 points.
Ah, yes, the wind pool. In Eastern medicine, it's thought to be where external stresses, tension, that wind collects, and that tension can directly affect blood circulation, especially to the brain. So these points are particularly powerful, especially for seniors, because they can help with both blood pressure and those awful tension headaches that often go hand in hand with hypertension.
Exactly. So how do you stimulate these? Apply gentle but firm pressure with both thumbs simultaneously into those hollows. You should feel a satisfying ache, maybe one that radiates slightly up or down the neck. Same pattern here. Hold the pressure for 5 seconds, release for 1 second, and repeat this for about 3 minutes. Many people report almost immediate relaxation in their neck and shoulders, often followed by a feeling of mental clarity.
It feels quite good, actually. Very releasing.
It really does. Okay, third and final point for today. Point #3 is HG7, or Shenmen. This one's called the spirit gate. You'll find this on your wrist. Look at the crease on the inside of your wrist on the pinky finger side. Feel for that prominent wrist bone there, the pisiform bone. HG7 is located in a little hollow just next to that bone, right on the crease, directly below your little finger.
The spirit gate. That sounds significant.
It is. It's considered the spirit gate because it's believed to directly calm the nervous system to soothe the spirit or mind. And calming the nervous system is exactly what we need to help lower blood pressure. The technique here is a little different. Use gentle circular motions with your thumb or finger for about 30 seconds. Then switch to applying steady pressure for another 30 seconds. Alternate between circular massage and steady pressure for a total of 3 minutes on each wrist. Many seniors find this point particularly soothing and convenient because you can do it pretty much anywhere. Anytime sitting watching TV, riding as a passenger in a car, whenever you have a free hand.
So what's the modern science perspective on why pressing these specific spots works? Well, current research suggests that applying pressure, the acupressure, stimulates these tiny sensors under the skin called mechanoreceptors. These receptors then send signals up the nerves to the brain. And in response, the brain seems to trigger the release of endorphins, those natural feel-good chemicals, and importantly, it activates the parasympathetic nervous system.
The rest and digest system again. Same one we talked about with breathing.
Exactly the same one. Dr. Ahmad Badir, a cardiovascular researcher, put it quite nicely. He said, these pressure points essentially hack into your body's existing regulatory systems, giving you manual control over automatic processes. It's like you're tapping into your body's own internal pharmacy.
Tapping into your body's own pharmacy. I really like that description. Now, really important, let's talk crucial safety guidelines for seniors when trying acupressure. First off, you should never apply acupressure over areas where you've had recent surgery. Also avoid areas with open wounds, infections, or skin rashes. Be very cautious if you have severe osteoporosis, that's significant bone thinning. A strong pressure could potentially be harmful. And if you have any blood clotting disorders or are on blood thinners, definitely talk to your doctor first, as bruising could be a concern. Remember the pressure rule. Always start light. Gradually increase the pressure until you feel that therapeutic ache or tingling we talked about. It should never be painful. Pain means you're pressing too hard, or maybe you're slightly off the point. And if you have limited dexterity, maybe arthritis in your hands makes it difficult. Don't hesitate to ask a family member or friend for help. Or, here's a little trick. You can even use the eraser end of a pencil for more precise, gentle pressure application.
Good tip.
To really make this work for you, just like with the breathing, consistency is absolutely key. Try practicing these points twice a day, morning and evening perhaps, even when your blood pressure is reading normal. Again, think of it as training. You're training your body's own pressure regulation system to work more efficiently. And maybe keep a simple log. Just jot down your blood pressure reading before and after your acupressure session. Many people are genuinely amazed to see consistent reductions, maybe 5 to 10 points, sometimes within just a couple of weeks of regular, consistent practice.
That's the encouraging part, seeing those numbers change.
Definitely. Okay, so we've explored the power of breath and these ancient yet scientifically validated pressure points. But what if you need something even more immediate, like right now during a sudden spike? This next method might sound a bit counterintuitive at first, but stick with us because it's backed by some really fascinating science.
Right. This brings us to what some researchers call the cold water paradox. Now, there was a comprehensive study review in PMC, that's PubMed Central, which looked into this. And here's the paradox. While it's true that that initial dunk into very cold water can cause a temporary spike in blood pressure, that's the cold shock response we hear about.
Which sounds bad for high blood pressure.
Exactly. Sounds like the opposite of what you want. But the research shows that regular controlled exposure to cold actually trains your cardiovascular system over time. It makes it more resilient, more adaptable, and ultimately better at regulating pressure. Think of it almost like exercise, but for your blood vessels. Just like lifting weights puts temporary stress on your muscles to make them stronger, controlled cold exposure creates a temporary cardiovascular stress that, paradoxically, leads to improved blood pressure control in the long run.
Okay, exercise for your blood vessels. I like that analogy.
What's truly fascinating here is how the body adapts to this controlled stress, leading to those long-term benefits. It becomes more efficient.
That makes sense. So how can our listeners safely incorporate this kind of vascular exercise? Especially since we know those extreme ice plunges you see online are absolutely not recommended for seniors, right?
Absolutely not. We cannot stress that enough. Forget the ice baths. Instead, we focus on something much safer and gentler called graduated cold adaptation. It's a progressive method that aims to give you the benefits without any dangerous shock to the system.
Okay, graduated adaptation sounds much more manageable. How does that work? Let's outline this progressive method, step by step, focusing on safety. For week 1 to 2, start with cold face therapy. This is super simple. Just fill a large bowl with cold tap water. We're talking around 60 degrees Fahrenheit, maybe 15 Celsius, definitely not ice water. Then just submerge your face from your temples down to your chin into the water for about 10 to 15 seconds. That's it.
And that simple act actually triggers something called the diving response. It's a powerful, innate cardiovascular reflex.
With a diving response.
Yes. Your body basically thinks you're diving underwater. So it automatically slows your heart rate and constricts some blood vessels to conserve oxygen and maintain pressure to vital organs. It activates that same vagus nerve we talked about with breathing. It shifts your system into a more efficient state, helping regulate blood pressure.
Wow, okay. So face immersion for a couple of weeks. What's next?
For week 3 to 4. You can progress to cold hand and wrist immersion. Similar idea, but just immerse your hands and wrists in cold water for about 30 to 60 seconds. Again, keep the water temperature controlled, maybe between 55 and 65 degrees Fahrenheit, around 13-18 Celsius. This is still very safe and controllable, giving you those cold exposure benefits without a full body shock. Then, for week 5 and beyond, if you're comfortable and have doctor approval, you might consider the cold shower progression. This is the more advanced stage. You simply end your regular warm shower with maybe 30 seconds of cold water. Over time, you might gradually work up to 2 minutes. But the key word here is gradually. Start cool, not freezing, and decrease the temperature slowly over weeks, not days. Slow, gentle adaptation is the goal. And the research really does back this up. Recent studies are showing that people who practice regular, controlled cold exposure tend to develop more flexible blood vessels. They respond better. They also show better regulation of stress hormones and just generally improved overall cardiovascular resilience. There was even one study looking specifically at adults over 60. After 12 weeks of this kind of gradual cold adaptation, they showed significantly better blood pressure variability.
Variability, meaning their pressure was more stable.
Exactly. Less prone to big swings throughout the day, more stable, more consistent. So if we connect this to the bigger picture, it's really about building robustness, building resilience in your body systems over the long term, not just getting a quick fix in the moment.
That long-term resilience sounds incredibly valuable. Okay, now this is probably the most important part for this method. Critical safety warnings for seniors. This needs to be crystal clear. This cold adaptation approach is not suitable. Absolutely not if you have uncontrolled hypertension. We're talking readings consistently over 160 over 100. Don't try this. Also, avoid it if you've had a recent heart attack or stroke, say within the last 6 months. If you have severe arrhythmias or other heart rhythm disorders or conditions like Raynaud's disease or significant circulation problems, and really, if you have any known cardiovascular condition, you absolutely must get explicit approval from your doctor before even considering trying this, even the face immersion. Safety is paramount here.
Cannot emphasize that enough. Doctor's approval is mandatory for anyone with pre-existing conditions.
Right. But what about that immediate situation? You mentioned this method might take time to build resilience. Is there anything using cold that can help right when you feel your pressure is high? Yes, there is a gentler, immediate application technique. It's the cold compress method. Simply take a washcloth, dip it with cold water, wring it out slightly, and apply it to the back of your neck for about 2 to 3 minutes. This helps cool the surface blood vessels there, and it can help trigger a gentle relaxation response
without the shock of full immersion. It's a much milder approach for that moment of need. And just a quick note on why this might work better than jumping into a hot shower, which some people instinctively do when stressed. Hot water actually causes vasodilation. Your blood vessels widen, which can sometimes temporarily raise blood pressure initially. Cold therapy, when done correctly and gradually, trains your vessels to be more responsive and resilient over time.
That's a key distinction. And it circles back to the main point. Cold adaptation, done properly, isn't about the shock, it's about the training. It's long-term conditioning. As Dr. Sarah Mitchell, a geriatric cardiologist, explains it, when done properly over weeks and months, this gradual approach can significantly improve cardiovascular resilience, particularly in healthy seniors who have cleared it with their doctor. And interestingly, patients often report seeing improved baseline readings days following their regular cold practice, not necessarily right during the cold exposure itself. This suggests it really is working on improving overall cardiovascular function. And sometimes, finding a local group or community that practices this safely can offer great social support and ensure you're adapting gradually and correctly.
That's a great idea. Okay, as we bring our deep dive to a close today, let's just take a moment to reflect on the profound impact these techniques can potentially have. We've talked about breathing, acupressure, gentle cold adaptation. These aren't just random methods. They really feel like keys, don't they? Keys to potentially reclaiming some control over your body, your health, and maybe most importantly, your peace of mind. I mean, I've heard stories from people who went from daily anxiety about their blood pressure numbers to feeling confident they could manage a sudden spike with nothing more than their own breath. Or think about couples maybe practicing acupressure together, turning what could be a health challenge into a kind of bonding experience. Imagine the sense of freedom that could come from potentially reducing medication needs over time through these consistent natural practices, always, of course, under your doctor's guidance.
It really does highlight a powerful ripple effect, doesn't it? When you take charge of your blood pressure naturally using these kinds of methods, you're not just helping yourself in the moment, you're also demonstrating resilience. You're showing perhaps your children, your grandchildren, that aging doesn't automatically mean becoming helpless or solely reliant on pharmaceuticals. You're proving that combining the wisdom of traditional medicine with the validation of modern science can create real, tangible change in people's lives. But, and this is the important part, knowledge without action. Well, it's just information sitting there.
That is so true. So the call to action here is maybe just to start small. Don't feel overwhelmed like you have to do everything at once. Choose just one method that really resonated with you today. Maybe it was the simplicity of the 4-7-8 breathing, something that requires nothing but 5 minutes of your time. Or perhaps it was the idea of those acupressure points you can easily practice while relaxing in the evening. Whatever called to you, maybe just commit to trying it consistently for 1 week. See how it feels.
And we absolutely must reiterate this one last time, firmly. Please remember, these techniques are intended to be in addition to and never ever a replacement for your regular medical care and your doctor's advice. Always consult with your healthcare provider before making any changes whatsoever to your treatment plan, especially if you have existing heart conditions or you're currently taking blood pressure medications. This is non-negotiable.
Absolutely non-negotiable. So the final thought to leave you with today is this. You likely have more power, more influence over your blood pressure than you might currently think. Your journey towards healthy aging, toward managing your blood pressure effectively, it's about progress, not perfection. It's about consistency. And it's about having the courage to take control of the things you can control. And remember, you don't have to navigate it all alone. Until next time, breathe deeply, press gently, and live fully.